Hello everybody, welcome back to my channel. Sorry it's been so long since I've uploaded one of these videos. It's a lot of stuff's going on the past couple of months, and it's been keeping me really busy and occupied, and I haven't been able to do much of anything other than my normal working and things like that. But this video we're going to be talking about treatments for PTSD, such as psychotherapy, and that focuses on the memory of the traumatic event and its meaning. There are several parts to the psychotherapy. One is the cognitive processing therapy, which is CPT. And what that is that's ways to understand how the trauma changed your thoughts and feelings. Changing how you think about the traumatic event will changing how you think about the traumatic event will help change your way of thinking and help change your feelings. And then there's prolonged exposure, which is considered as PE, and that can really be hard for people to do, because what that is going over the traumatic event over and over and over again, repeatedly. And by doing this, you can get to the point where the memories no longer upset you. And this also helps you get control over your thoughts and feelings. And also, a lot of things a lot of people with PTSD do is they tend to become kind of reclusive. And what that means is you don't want to go anywhere. Okay, you stop going to places you always used to go, stop doing things you always used to do, and things like that. And part of the treatment in the prolonged exposure is getting individuals to start going back to some of these places and doing some of these things they used to do, because in most cases these places you used to go and the things you used to do are really actually safe. Okay, and but being you have PTSD for whatever traumatic event caused it, you tend to be a little afraid sometimes even to go outside. So you really don't go many places, maybe to the grocery store, gas station, or something like that. Maybe to work if you have a job, and but you quit going to some of these other places, some of these restaurants that you may have used to go to. Doing some of the things you used to do that you found fun and exciting. And so getting back to doing that is another big part of that therapy, of the prolonged exposure therapy. And also it helps give you a little bit relief as well, in the sense that some of the places you used to go and some of the things you used to do may have been exciting to you or really relaxing to you, and they have quit becoming that way because you quit going to them. So going back to some of these places and doing some of these things is really positive, in the effect of trying to bring these symptoms down so that you can live a normal life with PTSD. And it's something that's not going to take overnight. It is going to take a while. It can be really, really rough to talk about some of the, about the experience that you had. It can upset you in the beginning, but the more and more you talk about it, the easier it becomes to talk about it. The more relaxed you feel, the more comfortable you feel talking about it. However, this is only going to work if you're doing this therapy with somebody that you really trust. And if you've never been to a therapist before, it's hard to know who you can trust until you talk to one or two therapists, get to know them a little bit, uh, get to know about them a little bit, and let them get to know about you. Because you're going to be opening up with a lot of information, and you want to be comfortable with this person. You know, if you're not comfortable with this person, 9 chances out of 10, you're not really going to talk to them, and that's not such a good thing. So, so you're gonna want to think about this. You know, if you have a family member that has PTSD or a friend that has PTSD, you may be able to kind of help them through. If they're really comfortable with you and stuff like that, they may open up and talk to you a little bit more as well, which will help them in therapy. Excuse me. Another part of the psychotherapy is the eye movement desensitization and reprocessing, and that's kind of hard to say. So you know, you can use the abbreviations EMDR, and that involves you know, focusing on sounds and focusing on hand movements while you're talking about your traumatic event. And this helps you in ways that it helps the brain work through the traumatic memories. Okay, and some of you think that would be kind of impossible to do, but as you're talking with a therapist or a psychiatrist or a counselor, you will get to understand how that process works, because it's all about your brain. Okay, it's all about kind of retraining your brain in a sense, because the traumatic event, you know, depending on the severity of it, may have been extremely traumatic to you, and you started thinking a particular way because that event changed the way you think and the way you feel. So what you're trying to do in this is you're trying to in a sense, rewire the brain. Okay, you're trying to get the brain to think, but think down a different path. All right. So if you can change your thoughts about the traumatic event, which over time you can change your thoughts about the traumatic event to where you can get to talk about it a little easier, and that's also going to change the way you feel. Okay. Now there are some medications that they use as well, like SSRIs. Those are those are called selective serotonin reuptake inhibitors. Okay, those are very helpful with PTSD. And then the other ones are SNRIs, and these are helpful with PTSD, and they also use them for depression. And those are serotonin, norepinephrine reuptake inhibitors. Now, in some cases, uh, depending on the severity of your traumatic event, psychotherapy may be the only process you need. I always recommend talking to a therapist before taking medications, and then you may be able to get by with just taking medication and seeing a therapist or a counselor, like maybe once or twice a month until your symptoms start, until you start reducing those symptoms. Once you get those symptoms reduced, uh, it makes life a lot easier for you, because then your traumatic event is not affecting, your doesn't affect your daily process. Okay, it doesn't affect your daily abilities. Like going places, going to work. Uh, your work performance will start coming back up, and you start going places again and start enjoying life again. Okay, the symptoms are what really drags you down as far as affecting your daily life, uh, affecting your work performance. So, it's always better when you have some positive people around you that has a little bit of an understanding of PTSD. So that way, if you have friends or family members that believe that you can't have PTSD unless you're in the military, or some even believe there is no such thing as PTSD. These people can be a hindrance to you, all right? And they need to learn a little bit about the dysfunction. They need to read up on it. They need to talk to some people about it and get a better idea about PTSD. Because when you have a family, especially a family member that says, "Oh, there's no such thing. You're just using that just like other people, just using that as an excuse." Those people are pretty ignorant, all right? And I'm not saying that to be calling them names, but I mean it. They are actually ignorant. They're ignorant about the dysfunction. They have no idea what the dysfunction is. You know, sometime down the line, they may encounter a tragic event. They may end up with PTSD, and they might start acting really weird and really strange and can't figure out why they're doing it. Well, if they have some kind of idea about it, then if it happens to them, it makes it a lot easier. But also, if they have some idea about it, some idea of the causes of it, the symptoms of it, and things like that, they can be a positive factor in your recovery. Now, is PTSD curable? No, it's not. Is it manageable? Yes, it is. And like I say, you can manage it through psychotherapy, or psychotherapy and medication, or medication. It depends on, like I said, it depends on the severity of the PTSD, and it also depends on what your therapist uh, feels is the best path for you to go down. And again, like I say in all these videos, if you suspect that you or some family member, one of your family members or one of your friends have this, then it is best to go and see a therapist or a counselor or a psychiatrist. Like I've said in other videos, it doesn't have the stigma now that it's had before. And so you can do that without much repercussion from other people. Other people saying, "Oh, wow, this person's seeing a shrink, they're crazy. This person's seeing a therapist, uh-oh, something's seriously wrong with them." Okay? Yeah, there's something seriously wrong, but it's not something that can't be controlled. You know? And like I say, it doesn't have the stigma it used to have. So, a lot of people are out there finding out that they need some therapy for depression, anxiety, bipolar disorder, PTSD, whatever, you know, and a lot of them aren't afraid to go get it now. So, with all that being said, I think that's going to be about it for the videos on PTSD. I'll probably pop back in once in a while with a little more information on PTSD. What I'm trying to do here is just give you the basics uh, so that maybe you can recognize if you or someone has it. Uh, Hopefully it will help you be able to help yourself or help them, especially in getting them to go see a counselor or a therapist, and to make life a little bit easier. And I hope that the people that are watching these videos are getting something from these videos. You know, that's my intention, is to help people get somewhat of an understanding of what's going on psychologically, and and try to get some treatment. Try to have a better understanding, get some treatment, get back to a normal life. And I think my next videos are going to be on anxiety and depression, because I see a lot of that. Uh, I know a lot of people that are going through that stuff, and I think that by giving them some tips like I'm doing here, uh, they'll be able to make the right conclusion, right decisions to go and seek help for it, and try to get their life back to some kind of normalcy. Now, I know that there is really no such thing as normal, just what society puts on people as being normal and not normal. Okay, so nobody really knows what normal is. But what I mean by normalcy for you is what you feel is your normal. Okay? Like me, my normal is probably a whole lot different than a lot of other people's normal. Okay, so what may be my normal may not be normal to other people. And I understand that, because we're all different. We all perceive things differently. So anyway, like I said, next videos are probably going to be depression and anxiety. And somewhere along this line, I'm going to throw some dog and cat videos back in there, because that's what I initially started this with. And I want to get back to that, because believe it or not, they are extremely important as well. Because anyone who has a dog or a cat has an extra child in their household, because they rely on you to take care of them. Okay? So, I guess for now, I'm going to say this is Bernie, baby. If you like this video, give it a thumbs up. Leave me a comment below. I'll comment back to you. And if you really like the video, subscribe, because there will be more videos coming. Okay? So for now, bye-bye.